Hi, good evening.
Hi, good evening. Thanks so much again for being here. There you are.
Yeah.
Let's first get to the news of the day. You know, we talked about this just last week, and now it's happening. Upstate is asking recovered coronavirus patients to donate blood to help treat severely ill coronavirus patients. Fill us in.
Yeah, no, that's correct. So SUNY Upstate, in collaboration with the American Red Cross, is asking for local adults, so people greater than 18 years of age, who tested positive for the SARS coronavirus 2, the virus that causes COVID-19. If they're more than 14 days from their last symptom, we ask that they get in contact with us. And what we would do is we would work with the Red Cross to collect plasma from these folks. And that plasma, inside of that plasma, is the immune response that they developed following infection. And we can leverage that immune response from that former patient to help treat current patients. So there you see the contact information up on the screen there. And we hope to start our operation tomorrow. We have 2 volunteers, and I can tell you the phone is ringing off the hook. So
Wow.
that's very good news for us.
You already have 2 volunteers. That's
We do.
incredible. And we'll, of course, have that information for folks at localesquire.com in case you didn't have time to jot down that number. The other news of the day, very upsetting. Upstate University confirming 16 of its employees have tested positive for coronavirus. So what steps are being taken to protect our medical workers on the front lines, Doc?
Right. Yeah. So, you know, one of the issues that both we and a lot of hospitals have is we're not sure where our healthcare workers are getting infected. We really can't do much to protect them on the outside other than to, again, to reinforce the importance of physical distancing. But what we do on the inside of the hospital is many things. The first thing is that we have a very strict policy for visitors, and that we are eliminating most visitors. Everyone who comes into the hospital, whether it's a visitor, an employee, or it's a patient, they will be screened. They'll have their temperature taken, and they'll have a brief medical history taken. Everybody who comes into the hospital is getting a mask. And then for the different wards that we have where we're taking care of people who have confirmed COVID disease or that they are being someone under suspicion, we have PPE for the healthcare workers to utilize. So that includes face shields or goggles. It includes the N95 mask. It includes gowns and also gloves. So we're really trying to do everything we can to provide a safe working environment, not only for the healthcare workers, but also the people that support healthcare workers, such as environmental services, nutrition, et cetera.
Right, we need you healthy. And I'd like to bring you in on the great cloth mask debate. We're hearing so much about that. You know, now we're hearing we should be wearing masks when we're out in public. How much protection can that offer? Where do you weigh in on this? And this is your expertise.
Right. So, you know, there's a lot of debate in the medical community about this, and it's an active debate, and I'm reading articles every day that from people that have different opinions on this. So what I'll do is I can share kind of what I view as the positives and the potential negatives. So one positive is that when people are wearing masks, they're visible, you can see them, and it should remind you that we're in the middle of a pandemic. And so it hopefully will make sure that people continue to remind themselves to, oh yes, I should be, you know, physically distancing myself from others. The other thing is the mask can provide some protection. And so one of the other pieces of news that's kind of getting more traction is that there's more and more evidence that people can be infected, not have symptoms, but be able to transmit the virus to other people. And so it's possible that by wearing a mask, even a cloth mask, might be able to lower the risk of someone transmitting to someone else. The other positive aspect of it is that it reduces stigma. So if a few people are wearing masks, they may draw attention to themselves, and that might be uncomfortable for them. If everybody's wearing a mask, then, you know, we're kind of all in this together. There are some potential downsides, though. So when you wear a mask, you're going to have an increased tendency to touch your face. So the ear loops might bother you. You're going to be trying to pinch your nose to make sure the mask is fitting well. You're going to be pulling it down to drink or to eat or to talk or to breathe a little better, pulling it up. We don't want you touching your eyes, your nose, or your mouth. And so you're going to have to be very cognizant of that if you do wear a mask. The other thing that wearing a mask can do is it can give you a false sense of security, and it may prevent you from washing your hands as diligently as you need to, and it might prevent you from not strictly interpreting the physical distancing policies that we want people to adhere to. And then the last thing is, when they look at the different types of masks, from homemade cloth masks to the blue ear loop mask to the orange N95 mask, they're not all created equal. And so the cloth masks that are made at home, although I said they could offer some protection, it's really the lowest amount of protection that you can have when it comes to masks, which is why washing your hands, not touching your face, good respiratory hygiene, and physical distancing still need to be implemented.
Yeah, no time to start relaxing any of that now, right, Doctor?
Yeah.
And we appreciate you so much, and keep us informed because your information is so valuable. Again, we're so lucky to have you in our community, and stay healthy for us.
Thank you. Yes,
Good
we'll
night.
do.